Welcome, everyone. This is Darlene with Generations Health. I'd like to welcome you to our webinar today, Caregiving from a Distance During a Health Crisis, presented by Jennifer Fitzpatrick. We are so grateful to have 5-Star Senior Living sponsoring today's webinar. And in just a few minutes, I'm going to introduce Alyssa Stout, who's going to give you a little bit of information about 5-Star. But before we get started, there are a few things I'd like to cover with you. The first is everyone is going to be muted for the entire webinar. And the reason for that is simply to eliminate any background noise. However, as this is an interactive webinar, we do encourage you to interact with us. And you can do this by utilizing the chat feature. If you are new to Zoom, if you scroll across the bottom of your screen, or it could be the top of your screen, you're going to see a little banner that pops up. And on that, you're going to see a little bubble that says chat. If you click on that, that is going to launch the chat feature, and that is how you're going to be able to communicate with us. Again, we do encourage you to ask any questions, answer questions that Jen may ask, or you are welcome to comment on the discussion that is taking place. As I mentioned, 5-Star Senior Living is sponsoring today's program, and I would like to ask Alyssa Stout with 5-Star to join us for just a moment and share a little bit of information about 5-Star Senior Living. Alyssa?
Yes, thank you, Darlene. So like she said, my name is Alyssa Stout. I am the sales director at Exton Senior Living. And in a second, I'm going to share my screen with all of you just so you can see the 9 other 5-star communities that we have in Pennsylvania. So they are all listed here from the Philadelphia, Scranton, and Pittsburgh area, and they all specialize in personal care and memory care. I'd like to start by welcoming you all to our webinar, and thank you all for being here. We decided to host this webinar because we truly do empathize with all of you and what you are all going through right now. We also wanted to embrace all aspects of 5-Star's mission statement, which is to honor and enrich the journey of life, one experience at a time. You know, current times have called for temporary changes in our senior living communities that have changed the way we socialize. However, the focus of our care team has remained the same. And that focus is to continue to provide positive interactions and wellness programs that keep our 5-star residents healthy and happy. While 5-star communities are here to support you, we also wanted to provide you with additional resources. So we're really excited to hear from Jennifer Fitzpatrick today on the topic of caregiving from a distance. Whether a loved one is afar, nearby, in an acute care setting, we are all experiencing different challenges right now. And we want you to know that 5-Star cares. We are here for you, and we are experts to provide you with assistance. So please don't hesitate to reach out to the sales director at your local 5-star community. We hope you learned today how to turn the requirements of social distancing, whether it's 6 feet, 6 miles, 60 miles or more, into meaningful interactions like we do within our 5-star communities. Thank you.
Great, thank you so much, Alyssa, and thank you again, 5-Star, for sponsoring today. All right, are you stressing because you can't visit your old one during this pandemic? Do you need ideas on how to remain connected to your loved one during this stressful time? If so, this program was created especially for you. Our presenter is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University. A popular media expert, she has been featured in the Wall Street Journal, Fast Company, Forbes, the Huffington Post, and the Washington Post. When she's not working, she can be found taking suggestions for what to binge watch on Netflix or Prime during this crazy time. Please join me in welcoming from Kent Island, Maryland, Jennifer Fitzpatrick, MSW, LCSWC, CSP.
Well, hello, everybody. It's so great to be with you all today. I see we've got folks from all different parts of Pennsylvania here. I'm coming at you from Maryland. Darlene is coming at you from Kentucky, actually. So we're really so fortunate to be able to have the opportunity to see each other on technology. It's getting more common right now with all this crazy situation that all of us are dealing with. And I know that if you are on this program, you're probably taking care of somebody from a distance. You have maybe a loved one. Oh, we've got somebody from North Carolina on. Awesome. Uh, we, uh, I think when you're taking care of somebody from a distance, maybe you can't see your loved one, maybe they're a couple miles away, or maybe like Alyssa said, they're 60 miles away, they're cross country, and maybe you visited them on a frequent basis and you're having challenges right now. A lot of us are struggling with that. So hopefully today will give you some ideas and some ways that you can connect more with your loved one who is you're distanced from right now, whether it be that that person is literally down the street or if they're really very far away. So what's going on right now? Nobody was prepared for this in the way that this has happened. And I don't think anybody thought that this social distancing would go on as long as it's been going on. So if you're vacillating between different kinds of feelings, know that that's really normal. Right now, you might be feeling really, really stressed, and there might be other moments where you think, well, my loved one's doing okay, I'm kind of at peace with it. And other times you might say, well, gosh, I think the social distancing should continue because I don't want myself or my loved one to get sick. And then other people might say, hey, it's time to open. So I know that it's a lot of us have vacillating thoughts and feelings about what's happening right now, but know that that's normal. I think what is really important is just to remember that this is a temporary situation that all of us are going through, and that we're going to get back at some point to some kind of new normal. This is not forever, even though some days it certainly feels like it. I'm on day, I think, 65 of sharing my home office with my husband, and it definitely feels like it's been longer than that in some ways. But the social distancing is temporary, and at some point we are going to get back to somewhat of a semblance of a new normal. So I'd like to ask Darlene to pull up the poll, and I want to try to get a feel for who's on today. And does your loved one live with you? Because some people, even though that this program is really for distance caregivers, maybe some of you just thought, you know what, I'm going to join just to try to get some ideas and tips. But does your loved one live with you? Do they live alone? Do they live with another family member? Or do they live in a nursing home or a senior living community? So take a moment to complete that. So we'll let Darlene tally those up. And even though we're not today really being able to be in person with one another, I do try to run these virtual programs as much as possible as if we were together. So please feel free to write into the chat section at any point, any comments, any questions, and I try to respond in real time as much as I can. Okay, so most of you, 63% are saying that your loved one lives in a nursing home or senior living. 26% say your loved one lives by themselves, and then a full 11% say lives with another family member. Okay, so everybody really is doing distance caregiving on this program today. Okay, so, we got somebody joining us from Florida. Great, okay, and actually we have a physician on today trying to help patients in all of the living arrangements listed. So thank you for joining us, Doc. That's awesome that you're trying to gain some ideas here. This wonderful. Thank you for all that you're doing. This is just an unprecedented situation, and we thank our essential workers like you, Doc. So thank you for writing in. So it gives us a little bit of an idea of who's with us today. So before we jump into the whole idea of long distance caregiving and how we can make it a little bit better, I want to talk to you about the concepts that I write about in my book, Cruising Through Caregiving. And you can download a free chapter of Cruising Through Caregiving, the book, cruisingthroughcaregiving.com, and all the worksheets that I mentioned today, you could download there for free as well. But in Cruising Through Caregiving, and the book came out 3.5 years ago, I talk about the concept of, in caregiving, we never want it to be one person doing everything. We want you to have a crew. a caregiving crew. Some people call it a team, but I liken it to being on a boat. So this is a picture of my husband on our boat. So I liken the primary caregiver to the captain of the ship. We only really want one captain of the ship. So when we're going through these descriptions, I want you to be thinking, like, where do you fall? Like, would you say you're the captain, the first mate, which we're going to talk about, or do you say that you're more of a dockhand? So the captain is really the person that's in charge, that they are making a lot of the decisions, maybe in partnership with the person who needs care, or if there's a dementia diagnosis, maybe really taking over all the decision making. But we never want the captain to do everything. Now, the reason that I say this is because even under normal circumstances, when we're all able to go to the grocery store without a mask, when we're all able to go to parties, when we can find toilet paper anywhere we want, this is something that I truly believe, that the person who's like the primary should not be doing everything, but they're the captain of the ship, and we really only want typically one captain. The first mate I liken to a secondary caregiver. So on a first mate on a boat, so that's a picture of me on our boat. And my husband is a great captain. And when he's out on the water, he could really do it by himself if he really wanted to. And in terms of docking the boat or looking out for debris, though, it's very helpful when there's a second person on the boat to be able to look out for anything. Are there other vessels out on the water when we try to dock, or if he needs something from, a life jacket to, a life raft to throw to somebody, or, it's always helpful to have that secondary caregiver. The first mate, who I liken to a secondary caregiver. So secondary caregiver is somebody that directly helps either the captain or directly helps the loved one. So what do I mean by that in terms of today? So again, I always believe in the concept that we want to have at least one primary, usually one works best, at least a couple secondary, and then lots of tertiary, lots of dockhands, but we want to have at least a couple secondary. So a secondary caregiver, maybe the primary caregiver is saying, well, the person I'm going to be the decision maker, the healthcare power of attorney, or I'm going to be the one that decides where that person moves to if they need senior living. A secondary caregiver or a first mate can do things like pick up groceries, pick up prescriptions, maybe checks in with your loved one to give you a break. So before this era and time of social distancing, it might be that this person would come by and maybe you're on a vacation. The primary caregiver, the captain, is on a vacation. And that there's a person, maybe the captain is one son, and then another son, when they're away, they check in on mom at the assisted living. They make the visits while the captain is on vacation. Now, of course, right now, it's probably, it's not going to be that in-person check-ins, but what can a secondary caregiver right now or a first mate do today? Well, I can tell you right now that one of the things my husband and I are doing is we have friends whose parents are by themselves. They're alone right now. And we're making phone calls to augment what those primary caregivers are doing. We're sending notes. We're setting up Zoom calls with them. And we'll talk a little bit more about some of those ways that other people can help. But under quote unquote normal circumstances, or when we get to the new normal, we want secondaries to be doing something active, either that can help the primary or that can help the loved one who has a condition. So I want you to be thinking about it. What role do you see yourself in? And if you are the captain, are you already utilizing these different roles? Another example might be a secondary caregiver. There are still a lot of people that have to get to the doctor. I have a friend who just had to take her mom for eye treatments for her macular degeneration. So this is another thing that sometimes a secondary caregiver can step in and do. Sometimes a secondary caregiver, maybe you are the primary caregiver for your mom, and your spouse is a secondary caregiver. They're not the primary so much, but they also help out by taking your loved one to the doc, your mom to the doc. So a dockhand. So when you're on the water, if you've ever been on a boat, a good captain often is going to be able to tie up the boat if they're trying to dock at a marina. Uh, Also, if they have a first mate, it's great because that person helps as well. But especially if it's a windy day, if the waters are rough, when you get to where you're going to dock and tie up your vessel, when there's somebody on the dock, a dockhand that's saying, I'm here to help, I'm going to throw you a line, it's invaluable, especially when the water is rough, especially when there's a lot of wind. So, or if it's at night, and this is invaluable. And so again, we want to have one primary, we want to have a few secondaries, or at least two secondaries, and then we want to have lots of tertiaries. And I liken them to a dockhand. So under normal circumstances, what kinds of things can they do? What we want them to do is they're not really going to have contact so much with your loved one, your older loved one, but this is somebody that's going to directly help you, the primary caregiver. So if you're the person who is in charge of mom and your husband is your secondary, well, then it might be a neighbor that does something to help you. And what kinds of things might they be able to do in this current environment? Certainly they could pick up groceries, prescriptions. They could do online research. Maybe you need an elder law attorney, or maybe you're looking up benefits for their long-term care insurance. Maybe this is something that person can do. Maybe they can mow your lawn, or maybe they can arrange or pay a kid to mow your lawn. So these are the sorts of things that this person's really probably not going to have any direct contact with your loved one who's older and maybe has some health ailments, but they're going to do things that can support you. If anybody has any comments or questions at all, feel free to jump in and share. I want to hear any comments or questions. And while we do that, we're going to run another poll. And I want to ask the question is, what role right now is yours? I want to see who we have on right now. Are you a captain? Are you a first mate? Or are you a dockhand? We'll give a little time to tally all that up. Tally all the poll up. Oh, wow. Wow. Okay, we are completely split. So we are 33% are primary. That's really interesting. 33% are secondary, 33% are tertiary. Okay, so I want to talk to the primaries first. Primaries, are you engaging the services of a secondary or tertiary? So I want to give everybody a minute to write in. For those of you who identify as primary caregivers, captains of the ship, tell us, are you engaging some help from secondary or tertiary, or are you trying to do it all by yourself? Because especially during this time of distancing, being far away from your loved one, it is more important than ever to engage a secondary, to engage a tertiary. So if anybody wants to write in, now if you have identified as a secondary or a tertiary caregiver, I want you to please write in what kinds of tasks are you doing during this this period of social distancing, this healthcare crisis, to help somebody, to help a primary, to help a captain, or to help an older loved one. So I'm going to leave that open. If anyone wants to share, we would love to share it with you. We'd love for you to share phone calls. Okay, so Deborah's saying she's doing phone calls like my husband and I are doing for our friends' moms and dads who are stuck at home. It might be sending a meal. There's all kinds of ways somebody can function as a tertiary or secondary while remaining socially distant, like the mandates are saying that we have to be. Okay, so feel free, I'm gonna keep that open if anybody wants to write in. Okay, researching specialists or scheduling appointments. Yes, that's something a secondary or a tertiary can do. Laundry, purchasing personal hygiene items, sending mail to cheer up. Living hundreds of miles away, handling finances, medical, and then they have another secondary caregiver who brings groceries and prepared foods. other secondary and a tertiary caregiver do grass cutting and maintenance, help with technology, new phones, Zoom. Okay, so all right, I love this. So we have somebody that just said, my loved one is in memory care. So as the captain, they're taking care of secondary and tertiary needs. That's really good. Okay, so thank you everybody for sharing that. I have always believed in the model that you can't do this by yourself or you're going to burn out, your health will suffer, your mental health will suffer. And if a captain tries to caregive by themselves, they are actually, and I know that people have a hard time hearing this, they're more at risk for unintentionally abusing or neglecting their loved one. So I know that we try to think about caregiving and we think, oh, all that abuse and neglect, that happens at a nursing home, or that happens by a stranger, that happens at an assisted living, and that is not true. Actually, a lot of abuse, neglect, and exploitation, financial exploitation, does happen at the hands of somebody that we know and maybe even love or trust. But I think sometimes we see people burn out, they're exhausted, and I think we see a lot of that going on right now if you don't have other help. Now, if you're living alone with your loved one and you're following the rules and you're going to do the social distancing thing properly, I get it. You're not going to bring in neighbors and friends to stay with your mom, or especially if he or she wanders. I get that. But at the same time, there are ways that you can bring in other help. And right now, if you haven't done it up until now is the time to do it. And for those of you who are secondary and tertiary, this is the time maybe to offer even more help, because, and again, if you're at maximized, the amount of help that you can give right now, that you don't have any more time or energy, we get that. But if you do have the energy and time, this is a great time to make additional offers to the captain. So again, I want to remind everybody, in terms of coping with being distant from your loved one, and most of you said your loved one is in senior living or nursing home. It's hard. It's so hard, but you've got to remember, and you've got to have a mantra and remind yourself that this is temporary. I don't know when this is going to end. I don't know how long this is going to go. I don't know how long you're going to be not able to visit with your loved one, but it is going to end at some point, and we're going to switch over to a new normal. There's going to be changes. The world, I don't think, is ever going back to what it was before this health crisis, but remind yourself it's temporary. I know there are probably more moments than not that you feel like it's not. It feels like it's been forever, but we will get back to seeing our loved one. And if you're missing them and if they're missing you, you just got to hold on to that. With this healthcare crisis, I want everybody to think for a moment. What's the last conversation? For the first person who writes in, we're going to send you a free copy of Cruising Through Caregiving. We can either send you the Kindle version today, or we can ship you a copy of the book. But for the first person that writes in, I want you to tell me, when is the last time that you had a conversation about something other than the healthcare crisis? Because all of us are focused on reality. Oh, everything's closed. Nothing's open. Oh my gosh, I can't have a party. I can't find toilet paper. What's the last conversation that you did not involve that topic? Okay, Sunday. Chris, thank you. You're the first person. Got a couple people wrote in yesterday, Friday. Politics. Okay, so we're going to give that to, I appreciate that you got in first, Chris. So, and it was a couple days ago. So, Chris, please send your email address to Darlene. Let her know if you want a Kindle copy, or if you would prefer to have a hard copy, and we'll get one out to you either way. But thank you, everybody. So, somebody says husband and the husband and I had to force ourselves not to on Saturday. It's like we all sound like broken records. If your loved one, think about how sick of all of us are about talking about the healthcare crisis. It feels like, what else can we talk about? And a lot of it we're complaining, and a lot of it is fear, and a lot of it is just lamenting about the uncertainty. But think about somebody who has dementia, whose brain isn't working properly. please resist the urge to discuss reality. Now, I've worked with a lot of senior living communities during this healthcare crisis, and they keep saying, oh my goodness, the family members call or they're on a Zoom and they're, oh, mom, you know, all these people are dying. The person has dementia. They get so upset. They can't wrap their head around really what's going on. It's scary and stressful for all of us, and our brains are working properly. Imagine the stress that it puts on somebody with dementia. And if they forget and you talk about it again. So I want to encourage everybody to just try really hard not to keep beating your loved one over the head with the discussion about the reality and the scariness of this current situation. So the other thing is, even if your loved one doesn't have dementia, don't discuss reality too much. Try, when you're going to communicate with them, think about what you would talk about if you actually were in person. What might you do together? Try to, some talk about the reality because we want to validate. People are afraid, they're nervous, they're anxious, they're stressed out. We don't want to underestimate that, but try to devote at least some of the time that you're spending with your loved one, whether it's on the phone, whether it's you're sending them a package, whether you're sending them a note, whether you're doing a webinar, a go-to meeting or a Zoom or Skype or FaceTime or something like that. Try to make sure that you're not talking constantly about shortages and the economy and people dying. I know those things are happening, but when you're spending time with your loved one, try to figure out other things to talk about. What can you talk about? The grandkids. You can talk about anything that has to do with, and I know it's hard because you think about what did you used to talk about with your loved one? Oh, grandkids, schoolwork, grandkids going to ballet recital, grandkids, oh, it's so exciting, their birthday party we're having. So I understand it's really tough to not bring up the current environment, but maybe talking about just something funny that their grandchild did, or some new skill that they learned, or that you taught them how to play Monopoly or Scrabble, because we're trying to keep them off screens all day. So try to think about what are topics that you can talk about that are not necessarily about reality all the time. So stay in touch. When you're caregiving from a distance, and for those of you, there are some of you who have said you're hundreds of miles away and you're probably accustomed to this. You're trying to stay in touch long distance, and others of you might be a mile away, but at this point it doesn't matter almost. So with video chats, I want to remind everybody, these are great. The Zoom and Skype and FaceTime and all GoToMeeting, all these different platforms are terrific, but know that people do get zoomed out. They do get it can be difficult being on lots of virtual chats. So think about that. If you have to do it a lot for work, don't underestimate the power of just using the phone. The generation that many of us are talking about, and I know that there's people that are boomers who need care, but the oldest adults that most of you are probably caring for, the traditionalists, they may or may not be tech savvy, but utilize the video chats, but don't make that always your default. Using the phone sometimes it feels more natural to persons of the traditionalist generation. Now that said, my mother-in-law is of the traditionalist generation, and she had never ever before done any kind of virtual video chat. And it was great. My husband set her up in 10 minutes. She has an iPad. Now, a lot of the traditionalist age group don't maybe have a computer, maybe they don't have a laptop, but and maybe don't have a smartphone, but a lot of them do have tablets. Make that something that you can teach. My husband helped my mother-in-law do it over the phone in 10 minutes, and she loves it. Now she's using it when she's not talking to us, and it's a really positive thing that happened there. But yes, video chats are great. But if your loved one isn't able to do a video chat. Don't despair, because in some ways, especially if they have dementia, or especially if they are of that traditionalist age group, think about just the phone. Okay, so think about the phone. So don't underestimate the power of a phone call. It doesn't have to be long, and this is where I want everybody, I'm going to talk to you about the MET exercise in a minute, but this is where you can really engage others, friends, family, neighbors, people in your faith community. So it can take a little bit of the stress off of you. So one of the reasons why my husband and I are reaching out to some of our friends' parents is because a lot of what they're doing when they make the phone calls is hassling them about what they shouldn't be doing and what are they eating. And these are people that need some help and care, but they don't have dementia. They're grown-ups. And my husband and I will just call and reminisce with them about something, or we'll talk to them about what's going on with our jobs and all the craziness converting. Like I'll talk about, oh, it's crazy converting events that were in person into virtual. Or my husband investigates financial fraud, and he'll talk about what's happening in the financial world. And it's a distraction, it's something nice, and it makes things feel more normal for your loved one. Now, I believe, again, like I talked to you about captain, first mate, Dockhand, I believe we should be doing this all the time. But right now, think about it. I know that people are working unless you're an essential worker, and thank you for the essential workers. We're so grateful for you. But if you're not an essential worker, you probably have time to pick up the phone and call a friend, a loved one, your aunt, for 5 minutes or 10 minutes once a week. I know people are homeschooling their kids. That's a whole other stressor. But this is the time, okay, when you can engage people to be part of your crew. That 5 minutes a week, can you call my mother and just say hi and just let her know what's going on with you? Maybe somebody just wrote in that they're in Florida. Mom is in Pennsylvania, you're in Florida. Talk about the weather in Florida. Talk about how things are a little bit different, because it's funny, I'm in Maryland, and my husband and I were doing a FaceTime the other day with our friends that live in Florida. And one of the things that they were talking about is how there's been more reopenings because they've had a lot less cases. And so that was really interesting. Yes, we were talking about the reality of the situation. I get it. I know we did talk about other things, but it was like, oh, okay, there's progress happening somewhere else. There's something new to talk about. Okay, so, but don't feel bad if your loved one's like, not interested in Zoom, not interested in FaceTime. I don't really want to do that. It really is okay. And in a lot of ways, a phone call is just as good to do as doing a Zoom. Okay. Notes. This is a great time to do letters and notes. Go through old photographs. So the other day, I had 3 friends have birthdays in the last week. 3 friends that I've been friends with for 20 years, 30 years, 35 years. And I went and made them video collages on my iPhone. And they loved it. They thought it was like the greatest thing ever. I had some time, I'm busy with work, but it was a fun project. I went through old photographs and I just did it on my iPhone. And you could do something like that. You can email it to them. I know a lot of persons will do email. If your loved one's in a senior living community, if they don't have email, you could probably email a video collage of old memories to the staff. That could be something that you do. If your loved one does text, great. That's, you can send them a video collage like that. But sending notes, or even just sending a hard copy of an old photograph in the mail with a letter, with a note, with a card, and letting them know you're thinking about them. But these are great ways to stay in touch. And again, this is where you can engage a crew. If you're a captain, and I know we have 33% of you are captain, 33% are secondary, 33% are dockhands. But this is another area where you can engage folks. Another strategy a lot of people are doing is writing a note via email to their loved one if their loved one's in senior living and they're having the staff read it to them, or just print it out for them. So that way they don't have to have an email address. But it's the same thing potentially with a video collage that you could do. So I keep bringing up the concept of a caregiving crew, and almost always when I bring up the concept of a caregiving crew, people will say, well, I don't have anybody. There's nobody. I've heard that a million times in all my years of being in this field. So what I'm going to do right now is I'm going to show you an exercise that you can download completely for free at cruisingthroughcaregiving.com. If you go to cruisingthroughcaregiving.com, you can get the first chapter of the book, and you can get all the worksheets and all the exercises. You can just print them off. So they come in Word documents. But I'm going to pull up the MET exercise. And the MET exercise, I just want to show it to you real briefly, is an exercise that will show you how to identify people in your friend, your family, your neighbor, your faith community that can be part of your caregiving crew. And I want to mention that right now is the best time to do it, because when somebody sees you call up a friend, like your mom's friend that you haven't talked to in 10 years, you say, you know what, my mom's in senior living, you know, maybe you could give her a call, you know, once a month, once a week. Maybe she's going to say, oh, this is great. I haven't connected with Mary in 10 years and, you know, I have time right now. Let me give her a call. And maybe they're going to make plans to, after all this, we get to the new normal, they're going to maybe get together in person. So I want everybody to be thinking like, this is the time to try to engage new people in your caregiving crew if you're a captain. Now, before I bring up the MET exercise, Jasmine, you're saying with dementia, are the benefits of technology worth the effort and resistance to change? Really common question, really good question. So first, I want you to think about if your loved one, how your loved one does with TV. So I once worked with a family where there was a gentleman that every day his wife would lay out his clothes. He had Alzheimer's. His wife would lay out his clothes on the bed after the bed was made, and he would take clothes and go into the hallway bathroom to change. And the wife could not figure this out. And then one day it occurred to her, because he said, you know, those people are watching me. So she would have on like a Good Morning America or Today Show, something like that. And he was under the impression that the people on the television were watching him. And some people with dementia react to television that way. So I would say if you have a loved one that has that issue, I would maybe not do it. Jasmine, I would say to you, you can always try it. Okay. Some people with dementia do great with this, that they're on a screen like this and it's fine. They're like, oh, that's great. That's my granddaughter. That's my son. Great. Some people just do not do it. If someone has advanced dementia, them being able to download software and log in, I think that's going to be really tough. But if they have somebody with them, like if they're at a senior living, you might try it. I think it's worth trying once. And again, unless you know for a fact that they don't do well with television. So those are my thoughts. You can try it, but if it's going to create frustration for you, frustration for them, it might just be something that you just use the phone. And the phone is in their long-term memory. So if anybody else has any comments or questions, feel free to jump in. Packages. So right now, my family's not too far from Exton Senior Living, who is sponsoring us, 5-Star Senior Living and all the PA communities. But my aunts are great bakers, and they have been baking cookies for all of the nieces and nephews. And it is, you would think it's a pot of gold that comes to our house when my husband and I don't bake. We're not good bakers. And we are so happy, and it's like a great way for us to be connected. And it's kind of funny. So for Mother's Day, I sent all my aunts Cheryl's cookies, which they're really good cookies. And I said, you know, just because we don't bake doesn't mean that we can't send cookies to you. But what kind of package can you send to your loved one with Amazon, with Target or Walmart, with all the different places that can send packages? It's another way to stay in touch with your loved one, to keep connected. It doesn't have to be something expensive. It can be something really minimal, but just letting that person know that you're thinking about them, something that they might enjoy. Maybe it's a special, a candle of a scent that they like, or, maybe it's something that reminds them of the beach and they can't get to the beach right now. But think about packages is a great way to stay in touch right now. So now for those of you who are not too far away, so maybe you are a mile away from where your loved one lives, doing the IRL, the in real life visits while observing social distancing. So at so many senior living communities, and again, I want to applaud 5-Star and Exton Senior Living. They are still safely moving persons in who need to move to assisted living right now, to personal care, which is great. I know it's not happening at every community, but they're able right now. They're doing it safely. But let's say you have your parent or your spouse or whoever it is that you love is at a senior living community, having a window visit, you going up to their window and calling, or bringing a pet to the window so they can see you, they can see the dog that they love. Also, what a lot of people are doing, I have a friend whose mom is in senior living, and mom comes over because mom can't have visitors, but mom still drives. She comes over to their house, and they probably stay 10 feet apart in the backyard, and they sit and they're able to chat and they're able to see each other IRL, in real life. The young generations call it IRL. But observing social distancing rules. I have some neighbors in my neighborhood who they are friends, and they ride every day that there's nice weather. They ride their bikes together, and they're staying a safe distance apart, or they're walking the trail together near our home. So they are seeing somebody else, and there's a semblance of normalcy that's occurring, but they're still maintaining a safe distance. Yeah, okay. So somebody's asking, can we visit and sit outside in nice weather 6 feet apart at a 5-star senior living community? That is a question that Alyssa would have to answer. And Alyssa, if you want to write in, you're very welcome to do that, or we can address that at the end. Okay, so however you'd like to do that, Alyssa. Another way that people can stay in touch during this long distance caregiving, pardon me, join virtual religious or social groups or book clubs. So in my county right now, they have all kinds of book clubs going on at the library that are virtual. And maybe you and your aunt who lives at a distance, who you're caregiving for, you're helping with, you can join something together, that you can do something with her, that you both go on to that book club. You both are reading the same book at the same time and you discuss it. So this is another way to insert something interesting, something fun that is not all about the pandemic, all about where do we get toilet paper, all about, oh my gosh, everybody is gonna, losing all their money in their 401ks. But having those kinds of activities that you can do together can keep you engaged with one another, because we want so much during this difficult time. We want to reduce the chance that, of course, I'm sure, know that you don't want to be isolated and lonely, and you don't want your loved one to be isolated and lonely during this time. Social isolation and loneliness is associated with so many, health risks and mental health risks, and you're more likely to be abused, neglected, or exploited if you are socially isolated and lonely. But again, just because we're social distancing doesn't mean we can't be social together. In fact, a lot of experts say we really should call this social distancing physical distancing, because that's really what it's about. We can still engage socially. Look, I know it's not the same. I haven't been to Exton Senior Living in a while. It's been a while since I've spoken at that community, but I wish I was there with you in person. Believe me, I'd much rather give a presentation to a group in the community. But right now, this is what we can do. This is how we can stay connected. And I'm so glad that you are all here today, because these are the types of activities that I'm talking about, whether it's getting information about caregiving, but again, book clubs, or doing virtual tours of museums together. There's so much free content out there, probably more than ever before. Okay, so Alyssa says that at 5-star, they have procedures in place to ensure that it's done safely. And then we have friends and family stopping by for window visits. Awesome, Alyssa. Thank you for answering that. But a great question, really great question. So if you are somewhat local to where your loved one is, again, this is a this program is different. When I do long distance caregiving seminars, I'm usually talking to people that are far away, you know, a plane ride or at least a couple hours car ride. Right now, you're long distance caregiving, even if you're local. But again, I want to say if you are somewhat local, take advantage of the good weather. Maybe go for a walk with your loved one, maybe do that, what Alyssa was saying that they can do, that make sure that you're safely visiting, or even just coming up to the window. It's funny because thankfully we have a treadmill in my house. My husband and I are so grateful for it. But you know, there's days where I'll be like, oh, I'm going to get on the treadmill, or I was on the treadmill, and he'll say, do you want to take a walk? And he'll remind me, because he'll overhear me saying this on these webinars, and he'll say, don't you always tell everybody take advantage of the good weather? Because you know, this is weird weather in at least in the Mid-Atlantic area right now. It's freezing out in Maryland right now. But when it's a nice day, if there's any way that you can sit outside together, that you can ride bikes together, that you can be at a safe distance, again, please follow the rules. We want to follow the rules. The more that we follow the rules now, the less I think that we're going to have to do this. But take advantage of the good weather if you are somewhat local. As far as assess what's not working. What is not working right now, and what will you do differently for the new normal? So, I'm going to pull up, I got distracted by that one question. I'm going to go ahead and stop sharing for a moment, and I'm going to pull up that MET exercise that I was telling you about. So I'm going to, hang on one second, share my screen again. Okay, so this is the MET exercise. And again, if you want these exercises, they're completely free. If you go to cruisingthroughcaregiving.com, you can download all of them. But I want to just show you what it is this is basically about a 20-minute exercise for how to identify people in your network, people that care about you, people that care about your loved one. So this step 1 is 5 minutes, and you're going to empty your brain of all the tasks that you're stressed about that might be related not just to your loved one's care, but what you need. When you get to step 2, you're going to set the timer for 2 minutes, and without regard for age, money, geography, anything else, 20 people who care about you, whether you're the captain, whether you're the secondary. And then step 3, I want you to take 20 minutes again, without regard for age, geography, anything else, 20 people who care about your loved one. Okay, and then ultimately you're going to match up the tasks that you need assistance with who might be able to help. So I'm telling you that this exercise helps you think about people maybe that you've never thought, oh, this person could help. Now, let's talk about this for a minute. We're all kind of in the same boat. We're not necessarily going to be able to ask a neighbor to hang out with dad while we go to the grocery store right now. That's probably not something that we should be doing. But what can we ask a neighbor to do? Can they make a phone call? Can they make a meal? If, maybe you're homeschooling your kids and you're trying to do your job and you're taking care of dad at home, can they drop off a meal? Maybe when all this passes, maybe you can do some nice things for them. But what I find interesting is a lot of times people, they find themselves in a situation where they dismiss, under normal circumstances, before all this craziness started, they dismiss, oh, that person lives in California. Oh, that person lives in Vermont. How could they help me with my loved one in Pennsylvania? But as you saw, there are people that are on this program that came in from North Carolina, from Florida, from different parts of the country who have loved ones in PA, and they're still engaged in caregiving. So what can they do right now? Can they mail a package? Can they send a note? Can they call once a week? You've got a great grandson who can teach grandmom how to use, FaceTime or something like that. And that's a way that they can bond. It's a way that they can connect. So what I'm going to leave you with before we turn this back over to Alyssa is I want you to consider and assess what's working right now for this time period and what's not. So before all this craziness started with the healthcare crisis, what was working, and then what are you thinking might be better when we get to the new normal? Do you want to let more people into your caregiving crew, friends and neighbors and faith community of friends and family? What might you do differently? So I think one of the things that's happening to a lot of family caregivers right now is they're realizing some things that are not working. So if you're home with your loved one, or if your loved one's at home by themselves, or maybe they're living with another family member and that person is so stressed because of the circumstances, maybe it's time to look at, okay, maybe it's time for senior living. And that might be a decision that you make now, even, but be thinking about it. Is this something that we should consider? You know, I don't think that anybody ever thought we would be in this stay home order for this long. I know I didn't. I hoped not. And I'm certainly hoping that we'll be not doing it, you know, much longer. Of course, we want to keep everybody as safe as possible. But what will you do when we get to the new normal, when adult day opens back up? Is that an option for you? Utilizing home care is something that you could even look into now, but looking at what are your options, what are the types of services, you know, is it that you need to get your loved one diagnosed? I mean, that you're concerned about their memory and you need to take them to a specialist, maybe make an appointment now where, and you know, they'll, if they can't see you, they'll, you know, they'll let you know, but if there's something that you need to be doing differently when we get back to somewhat of a new normal, a lot of healthcare services, just like, you know, it's funny, I work with a lot of senior living companies and not all of them are accepting new residents. You might be surprised. Like, it might be that there's a memory clinic where you can get your loved one assessed right now, or, you know, they're taking appointments for, maybe they're planning to try to, when things reopen a little bit, that you can get in. You might be surprised, but I want you to be thinking about what's working right now. Where's your stress level? And when we get back to somewhat of a new normal, for some of you, it might be, you know what? We're at a distance. We're at a true distance. Mom is 200 miles away. I need to think about, do I need to bring her closer, or should she come closer to me? But this is the time to be planning and to be thinking, how do we want things to look for our caregiving situation after the healthcare crisis begins to pass and it's in our rearview mirror? If you don't have a caregiving crew, now is the time to build one. And when you have people doing virtual tasks for you, like doing online research or picking up, they're going to the pharmacy anyway, they can pick up your loved one's prescription, or they're going to the farmer's market anyway, they're going to pick up your vegetables. Right now, there's a lot of people with more time on their hands than they've had before. Now, again, we're not talking about essential workers. And there's a lot of people that they're homeschooling their kids and they're wringing their hair. But there are other people right now that they do have the time and they want to help if they can. Right now is the time to build your caregiving crew if you don't have one. If you want that MET exercise, please go to cruisingthroughcaregiving.com, and I really believe it will help you identify people in your network that maybe you haven't thought of previously. Think about it. What do you want things to be different? Is it time to be thinking about senior living in particular? So I want to thank you all so much. And I'd like to invite Alyssa to come back and share with us some more information about, I think, Alyssa, are we going to be, and we also have a survey that, Darlene, if you would take 1 minute, it's about a 1 minute survey to just let us know any feedback that you have for us today. Thank you all so much. And Alyssa, it's on you.
All right, thank you, Jennifer. That was wonderful. Yeah, so like Jennifer mentioned, 5-star is still, our communities are still open for admissions and move-ins, because there are people out there who do, you know, still have a need. And everything that Jennifer talked about are things that we have put in place. I mean, of course, we have kind of a different process for moving in. You know, we're offering virtual tours. virtual assessments, and we just have some extra layers in place to keep everybody safe. But we are still available and a resource. You know, we're still having our activities daily, our programming, whether it's hallway bingo, cooking demonstrations. Our therapy group is still providing exercise classes, you know, in the hallway at a, you know, social distance from one another. We don't have to worry about having people bringing groceries and things like that because we are providing all 3 meals every day. And of course, our residents are getting all of the care that they need. So if you have any questions, I have my contact information on the screen here. Feel free to reach out to me. And if you're not from the Exton area, I will connect you with the sales director at one of our other communities. So feel free to just call or email me. All right, thank you.